So my name is Tracy Glenn, and I'm the National Director of Operations and Projects for the Canadian Health Coalition. And as you can tell, I'm not in Legacy Dowson, who was supposed to be the host of today's webinar on threats to Canada's blood supply, but due to unforeseen circumstances and could not be with us today. So I'll be hosting today's webinar. I do want to begin by acknowledging the territory. So I am joining you from Fredericton on the unceded territory of the Wolastoqey. The Canadian Health Coalition does much of its work in Ottawa on the unceded Anishinaabe Algonquin territory. It is a very difficult time for Indigenous communities in Canada right now. The Canadian Health Coalition recognizes that health problems facing many Indigenous peoples are linked to colonial processes and systemic racism. And we hope to do more work with Indigenous health advocates to eradicate all barriers that people face when they try to access quality healthcare. So stay tuned for a future webinar on that topic. So today's webinar is brought to you by the Canadian Health Coalition. We are a coalition of frontline healthcare workers, community groups, researchers, all committed to defending Canada's public healthcare system. So the Canadian Health Coalition hopes to bring you these webinars monthly. So today's timely topic is plasma and how the buying and selling of plasma threatens Canada's blood supply. The webinar is being recorded and will be made available after the event. So today we are joined by three experts who have lots to say on the topic of blood and plasma. Dr. Michèle Brill-Edwards is a pediatrician and the Canadian Health Coalition's longstanding board member responsible for blood and plasma issues. Dr. Brill-Edwards has unique expertise in Canadian drug regulatory science, medicine, and law. As Health Canada's former senior physician, responsible for the regulation of clinical trials and market approvals of prescription medicines. She resigned in 1996 to blow the whistle on Health Canada's safety lapses. Throughout the Creever inquiry, she advised blood injured groups on the regulatory negligence of Health Canada and the Canadian Red Cross, causing Canada's tainted blood catastrophe. In 2019, Dr. Brill-Edwards testified in support of maintaining voluntary donation of both blood and plasma in Canada during the Senate hearings on Bill S-252 to ban payment for plasma in Canada. She has recently retired from clinical practice and teaching in pediatric emergency medicine at the Children's Hospital of Eastern Ontario in Ottawa. And we're also joined by Kat Lanteigne, a Toronto-based writer and actor, a safe blood advocate. Her play, Tainted, tells a story of how the tainted blood crisis impacted Canadian families. It premiered in 2013. Kat was the lead advocate who successfully petitioned the Ontario government to ban private paid plasma centers from opening, and subsequently toured her play to support the legislation. In December of 2014, the Voluntary Blood Donations Act was passed in a unanimous vote in Ontario. The tainted blood crisis and the Creever inquiry have been at the center of her life's work as an artist. She's a co-founder of bloodwatch.org. Kat has traveled across the country to stop private plasma centers from opening it and harming the integrity of Canada's blood system. And last but not least, Daniel Légère is the elected president of the New Brunswick Federation of Labour, a position he's held since 2019. Danny started his union activism soon after beginning his career as a correctional officer in New Brunswick in 1980, becoming a shop steward during, and he's held many positions within the Canadian Union of Public Employees, including as local president and most recently the president of CUPE New Brunswick, a position he held from 2005 to 2019. So before offering as president of the New Brunswick Federation of Labour, he was the president of CUPE. As a social activist, Danny is a member of the Provincial Council of the Common Front for Social Justice, an anti-poverty network that brings together people living in poverty, unions, and community groups to work on employment reforms, better social assistance policies. He's supported the work of the New Brunswick Health Coalition in trying to stop the privatization of healthcare and is a strong supporter of pay equity. Okay, So let's get into it. I'm just going to make sure that everything's working. I'm being told that the chat is still disabled. Is that true? Oh, just a second. Okay, maybe that will work now. I hope that works. Let me see. It does. Okay. Okay. Sorry, this is my first webinar. Usually I do events in meetings, but it's all going to work out and it's going to be edited. Yeah, so we're going to get right into it. So the first question is directed at Dr. Brill-Edwards. Can you tell us the difference between blood and plasma? Can you explain what is involved in donating plasma versus selling plasma?
Yeah, I think there are some important distinctions for everyone to understand from the get-go. It's a complicated scenario that we're discussing today. Blood is, of course, the red stuff that you see when you bleed. It is composed of solid components and liquid. So solid components are things like red blood cells, white cells, platelets, things that we need medically in many different ways. The liquid is plasma, and what that is a straw-colored liquid in which all these cells are floating around in our bodies. And the important thing to understand right now in this talk is that plasma is not just a liquid like Freshie. It has proteins, very valuable proteins floating in it. So this is more like a chicken broth, really, with very healing proteins that are both financially and medically very valuable. And the other key point is to understand that there are actually two separate systems for collecting blood and collecting plasma. You might rightly think that, oh, we get plasma when we collect whole blood. And that's true. When you go in and they put a needle in and take blood out, that's what's coming out, blood and plasma. But the traditional collection of blood yields only a small amount of plasma, not nearly enough for the large quantities of plasma that are required for harvesting by manufacturing very valuable proteins that are derived from plasma. So a whole industry, a for-profit industry, has grown up around this other process, this second process, whereby we collect only plasma. And so why does that matter? For two reasons, really. Firstly, we can collect huge amounts of plasma, way more than we collect when we're just collecting whole blood. So that's a plus for the industry. And secondly, the system for taking that plasma leaves all the good stuff, the solid components, the red cells, the white cells, the platelets, in the person's body. So when they leave, they've only lost plasma. That can be regenerated very quickly in the body. So it allows people who provide plasma only to do that very frequently. So as much as weekly or even twice weekly. So you can understand that system of plasma only collection is what industry is after. That is the source for the raw plasma that can be turned into these very valuable proteins. And just to explain the financial and medical value, financially, ounce for ounce, those finished proteins are more valuable than gold. And in a medical sense, they're extremely valuable as well. They're life-saving in some circumstances. So about a quarter of the use of those plasma proteins is truly life-saving for the people who need that product. So that sets up a dilemma for us. The The size of that new collection of plasma only, which has been going on for about, I say new, but it's 3 or 4 decades. The size of it is growing worldwide. The initial industry formed in the US, a for-profit industry where Americans are paid to go to a center and allow their plasma to be drawn off. And they can do that repeatedly, so it becomes an important source of income for them. There are some safety issues regarding that, but there's also a supply issue. The whole world is really relying on the US production of these valuable plasma proteins, especially one in particular called immunoglobulins. Big, long word, but we shorten it with the term IG. So the US for-profit system provides about 75% of the world's plasma products. So there are a few countries in Europe, 4 countries that do also, but it's really the US system that is fundamental. It is now not enough. The world supply of paid plasma proteins, excuse me, is seemingly inadequate. That has led to the worldwide search by the industry, excuse me. That has led to a worldwide search by the industry for new countries, new places where they can pay citizens to sell their plasma to the for-profit industry. So I'll leave it there, but just want you to understand it gets very complicated. And the probably the most important message right now is that the blood system is a voluntary system, and that is obligatory. So that first system where we take whole blood, that has to be voluntary. It cannot be a paid system. That is our issue today. By cooperating with the paid plasma industry and making that a process across Canada, are we threatening the sustainability of our whole blood voluntary system?
Thank you, Michelle. So we'll maybe go to Kat now. Maybe you actually asked sort of the question that I was going to ask next about are we threatening our blood supply? If you could tell us more about why buying and selling plasma is a bad idea. I think oftentimes people don't immediately think of it as a bad idea. So maybe Kat, this has been your life's work too, and tell us more about why this is a bad idea.
One of the biggest challenges to permitting the takeover, which is essentially what it is, it's a en masse takeover of collecting plasma that's happening, which is primarily a push from the industry and the private plasma industry and some of the patients groups that support that industry, who are ongoing plasma users, which is really important. We also represent patients who are ongoing plasma users. We are co-founded, by Tainted Blood Survivors, and built a coalition. We work very closely as well with the British Columbia Hemophilia Society, who represents patients in that province. And so there's a divergent view between different patient groups, and there's a divergent view on this issue. So fundamentally, from a business perspective and from a public health perspective, the reason why permitting private for-profit commercial blood brokers to gain control over the plasma supply is multiple. There's multiple challenges to that. One of them is you don't control your supply anymore. The industry does. So it becomes very challenging to manage your blood supply, whether it's whole blood, transfusion, vein-to-vein transfusion with plasma that isn't made into a plasma-derived product or a plasma-derived product. And so it becomes, you're negotiating then that product with the industry and the market driven environment instead of patient need. So it is true that there is a challenge with the plasma supply around the world because countries essentially were buying cheaper product from an industry that exploits, it's 80% of the plasma that's collected in the US is from the vulnerable and populations, poor and abject poor. So we know that is just an industry standard of collecting, of where they set up their plasma paid for shops. They've had huge difficulties recently because of COVID, because of universities, students not at universities. So they set up close to universities and it becomes more difficult for them to access the students that they draw into the system, their system. But fundamentally what it does is it becomes a market commodity that is then forced to be negotiated through the eyes of the market, not on patient need. So plasma essentially, as well as blood, is a finite resource. Whether you pay people to sell their plasma or not, there are only going to be a certain amount of eligible donors in your population who are willing to get a needle in their arm to contribute that product as a life-saving product for other people. And so when you base it on patient need, you can manage your supply chain. You can manage cost, which is a very important factor here. And you don't get buckled under the market demand because you actually become self-sufficient. So there is this idea that the for-profit industry is what makes countries self-sufficient, which is a myth. Because in the last 5 years, even the 4 countries that have permitted the for-profit industry have had supply chain tensions. So those ideas don't go together. And the US has huge supply chain tensions because of the for-profit industry that must be able to export their product as well in order for them to make the kind of money that they do. So it's driven on a market demand instead of a patient need. So fundamentally, from a business acumen point of view, it's a bad idea, because if Canadian Blood Services collects the plasma on our behalf, it's called toll fractionation. So they take our plasma, they go to different fractionators or drug companies, and they create a contract to have that service of that product manufactured, and then it is distributed to our patients here based on need, because Canadian Blood Services has identified the patients that need plasma-derived medicines. The other problem is that, and it was also in the Health Canada report, there's been a huge study that was issued in 2020, and I'll put our email, so any of the studies that we have, we can share with the group, have indicated that the 40% rise in these IG products does not have scientific support for use. And that is what ends up happening when you have a market promoting a drug that is covered, that's no cost to the user, the patient. We wouldn't want it to be. And we have no way of tracking what other patients outside of these very specific patient groups are using IVIG and what for. So if we look at it from that perspective, in terms of supply management, it's responsible for us to be able to collect that plasma on our behalf to secure the supply, because we do not then suffer from, the changes in the market and the profit-driven motive of how to make as much possible funds as they can off of this source. The second piece is, and so we have to base that on the evidence today that's real-world evidence. The other piece to that is that every single international body in the world, whether it's the European Blood Alliance, the WHO, the International Society of Blood Transfusion, and the list goes on, has taken the position that countries around the world need to increase their supply of plasma through the voluntary system. It protects the donor, It ensures that the donor and their donor health is integrated in our national system. It makes traceback for donors transparent and easily accessible. It ensures that the donor is not being exploited. Another myth is that Europe has adapted the American system. And in countries like Germany, for example, it's extremely regulated. So it becomes cost neutral for people. So the private industry is not permitted to do what we do here, which is essentially, give people financial bonuses for bringing in a friend and getting people on a Visa card, for $600 to $800 a month that they're paying to sell their plasma. For that they then have a fee taken off of, because that system in itself is very problematic. So when we look at that, we asked why recently in March, when we were at the International Plasma Conference in Amsterdam, have all these organizations and countries maintained these recommendations. And fundamentally, it is the two things: safety, which is a chain. So we make our point that the plasma itself does not have to be infected with a new novel pathogen in order for safety to be a concern, because it's a whole entire chain of safety. And supply management of actually having control over your national supply, because it's a public health resource. This is so important to the health and safety of the general population, whether you're a whole blood user, whether you're an ongoing plasma user, or whether you're getting a vein-to-vein plasma transfusion, that it's the only way to responsibly manage a donor base and a blood system. And so I know I said a lot there, but that is, these are the things that are happening in real time today. What our major concern is that Canadian Blood Services is currently, we believe, negotiating a contract with Grifols Pharmaceutical, who has bought out Canadian Plasma Resources business partner in Germany, and that there's a huge major national takeover about to happen of Canada's plasma collection system. This is just, it's shocking, it's unacceptable. Stakeholders should be informed. But the other problem is we literally just opened all these plasma centers for Canadian Blood Services. And we're about to launch a huge plasma collection strategy to bring us to self-sufficiency. And that would be in direct contradiction to that plan.
Thank you, Kat. We can for sure spend some time. Folks can ask questions on all the things that you said. Maybe we'll go to Danny now. So we have these for-profit plasma centers in 4 provinces, including New Brunswick. So Danny was involved with trying to stop the center in Moncton. So maybe Danny, you could share your experiences trying to stop that center and what's happening in New Brunswick right now. I think you're muted.
Thank you, Tracy. Before I start, I want to, as a treaty person, I want to acknowledge that I'm on the unceded Indigenous territory of the Mi'kmaq First Nations. We got a bit of lead time before the clinic opened in Moncton, and the labor movement mobilized quite quickly. The first thing we did is we educated our members and the general public against the for-profit paid for blood product. We also worked closely and engaged our coalition partners, such as the public sector unions, the NB Health Coalition, the New Brunswick Federation of Labour, and of course, Blood Watch was very helpful. Actually, Blood Watch was a key partner in the resistance in New Brunswick, first of all, making us aware of the clinic coming to Moncton and helping us with information as well as templates and signs by passing those on and as well as on the ground support. And certainly Kat Lanteigne presence in the province and on the ground was extremely helpful, whether it was at rallies or during lobbies with government officials. What we did is we printed lawn signs. I actually have one here, but it doesn't, for some reason, work too well with the camera. We did car magnets, we did leaflets, and we distributed those widely in the greater Moncton area. We held demonstrations and rallies, and we had a number of lobbies with the then Liberal Health Minister, Victor Boudreau, to try and get him to reverse the decision the province had made to allow this for-profit clinic to open in Moncton. Unfortunately, we were not able to stop the Moncton Clinic to open. However, I believe what we were able to do is to delay the opening of clinics. We now have one in St. John that I just heard about on the weekend, and there's one either opening soon in Fredericton. At the time, I guess at the end of the day, these are political decisions that are made, and the only way we're going to be able to stop this is politically. Without the licensing or regulatory approval from provinces, because healthcare falls under provincial jurisdiction, we need to be able to convince governments not to regulate that if these private clinics, if we don't want them to start popping up in our communities.
Thanks, Danny. So going, on that, so there's legislation that some provinces, I think, well, at least Ontario has around voluntary blood. But I don't know if Kat or Michelle, if you want to talk about that legislation, tell us more about which provinces have this legislation, what's good or bad about this legislation, and what can be done to encourage other provinces to enact like what Ontario has. I'm not sure.
Kat, you go ahead and I'll fill in with the federal angle if you like afterwards. Yeah.
Can you hear me?
Mm-hmm.
Okay, so I just wanted to just say one thing before I talk about the provincial laws, which is it's important for our guests to know today that there's absolutely nothing, and I mean nothing, that exists in the Federal Blood Regulations Act that can deter any of these companies from selling our Canadian plasma abroad for profit. It does not exist. It does not exist in that act. So that means even if Canadian Blood Services went into the supply chain deal, because there's at least 24 of these paid plasma facilities in the queue, that the additional plasma they collect is for the international market. So that's just important for it's under this banner of the world supply, right, of plasma, this world product that they argue. And so what we just become part of that American system is my point. And so the only way we can restrict currently, because the Health Canada as a regulator refuses to take responsibility for the fact that they actually don't have to license these companies, that they can make a decision. It's one decision. They don't even have to have, the health minister can say, no, we're not licensing these companies. We're upholding our part of the memorandum of understanding of which they are a party as our regulator. The only way to deter them is through the provincial laws. So the Voluntary Blood Donations Act that we had passed in Ontario ensured that they could not set up, because the actual act of payment, of paying somebody to sell their plasma or blood or plasma, had been banned and made illegal. We had that law then passed in British Columbia, and then we had that law passed in Alberta as well. As you can all imagine, I'm sure there's lots of our allies. It came at a tremendous amount of work and grassroots organization. But the arguments that were made to the legislators at that time, it was a unanimous vote in BC and a unanimous vote in Ontario, were very similar than they are today. The difference is today we have even more evidence that that is the right thing to do, not less. And COVID has actually taught us that a novel pathogen can emerge that doesn't actually, impact the blood directly, but it indirectly impacts the blood system because it removes donors from access. So right now we're 30,000 whole blood donors short. America is in a critical capacity for whole blood and has been for, months now. And so creating competition between donors is a terrible idea, because if Canadian Blood Services doesn't manage them, because if you're a whole blood donor, you can donate plasma. They just switched their 3, whole blood donor centers to plasma centers and switched donors over. So that donor management is critical to being able to manage your blood system. And so without those laws, we can't protect our supply chain, but we also can't protect our donor base, because it becomes partitioned and there's no access to those private companies. So to be clear, what is done is that the plasma itself is tested. That's what Health Canada oversees. They ensure that the plasma is tested, and they ensure that the actual facility itself is up to regulation code. And it ends there. It ends there. And so those corporations can sell our plasma, Canadian plasma, to China. They can sell it anywhere that there's a buyer. So without those provincial laws, that's what has made us vulnerable. And in closing, when our law got repealed in Alberta, last year, it was particularly focused on a political, ideological premise of privatizing a part of plasma collection for the sake of supporting industry, the expansion of private jobs. And it was done not by the health minister, but by a private member through a private member's bill. So the health minister didn't have to wear it. And our organization, which represents people who have HIV and hepatitis C and patients who use plasma, we presented at committee. We were called an extremist group by the current administration for trying to protect our national plasma supply and protect our blood system. And the premise was that anybody that supported, essentially our only argument they have is that it's hypocritical, and they do it in the US, so why not do it here? And so that's currently where we're at. We have it on record through our allies in Alberta that if the NDP do get in, they will reverse that, which they have every right to do, because of course, Health Canada is the ones that give the license a company. So even provinces, Danny in New Brunswick, they could implement the Voluntary Blood Donations Act, and that's it, because New Brunswick hasn't given them the license, the feds have. So they would have to then take their case to the federal government. And since the provinces fund the blood system with $1 billion a year, it's financially responsible for them to pass this law in order to protect our public investment.
Thank you. I'm not sure if Michèle, do you have anything to add?
Yeah, just to, Kat's done a good job of explaining the laws in the provinces of Ontario and BC and Alberta. I would just add two things. In Quebec, there has been a law in place since the 1990s banning payment for blood or plasma, and and they are increasing their plasma collection admirably. The second thing is that we let the feds off the hook in some ways. This is part of a drug deregulation policy to have Health Canada be more agreeable to the initiatives of the drug companies to do as they please. It's called voluntary regulation. And the Health Canada under deregulation tries to deny authority and responsibility to regulate in order to defer to the companies. And it's a widespread global process over the last roughly 4 decades. There's a Canadian book that's just been written on deregulation, and we have chapters in there about the deregulation of Health Canada. But as it applies to blood and plasma, the key is that Health Canada claims, wrongly in my view, that the Food and Drugs Act does not permit them to regulate the payment for collection of either blood or plasma. They claim that on the basis that they say it's not a safety issue, and trying to say that only safety is governed by Health Canada under the Act. 2 points. I would say it is a safety issue. Yes, we can inactivate viruses and other pathogens in plasma by some methods, but we always have to be prepared for the next new pathogen that cannot be inactivated or removed by the current systems. And we know that there's research evidence showing that blood and plasma collected from voluntary donors has a lower level of innate infection than plasma and blood collected from paid sellers of plasma, persons who sell plasma. So that is a safety issue. We do expect the regulator to be cognizant of the very real threat of new infection today or tomorrow. That is within Health Canada's authority, but they're just refusing to acknowledge that. And the second issue is that the responsibilities of the federal Minister of Health include very broad responsibility for the health of Canadians. The blood and plasma supply for Canadians is a very crucial national health resource. So automatically that gives the Minister of Health authority to take measures that ensure that we will not face crisis shortages. So the management of that national asset, that national health asset, is under the authority of the Minister of Health. Unfortunately, again, under deregulation, those kinds of authorities are not enforced, are not acknowledged, and it impedes the proper management of this very, very crucial national health resource.
Thank you, Michelle. Kat, did you have your hand up? Oh, go, Kat.
I just wanted to say that because we do a lot of work tracking industry, and that we do attend, we have a lot of strong relationships that we've been developing across the world with our friends in Europe and other organizations. Mm-hmm. Something which the industry, which is the plasma industry, their acronyms, the PPTA, were very concerned about was the updated EU regulations and recommendations on substances of human origin. They call it SOHO. So, and they have just released those recommendations, and the industry is not happy because they reaffirmed the ethical piece of the donation of human tissue, which includes blood and plasma. And they also reinforced donor protection. And in those recommendations said, in order to protect the donor, not incentivizing donors to sell their plasma, perhaps against their own interest and their own health at the time. You have to understand the industry doesn't provide data on donor health, and the stuff they do is primarily it's not independently researched. It's also voluntary. So all of the information that you get out of the United States, if the industry or the companies choose to share it, you don't really get a very good oversight of patient health. So in the EU, and even in the countries where it's permitted, they do not permit this widespread twice a week donor, up to 104 times a year. Canadian Blood Services would never collect plasma from a donor at that rate either because of donor health. It's a lot, even though you're not donating whole blood. And so because of those updated regulations, which I can send you and you can look at, and I recommend going on the European Blood Alliance's website and reading their material, what that message has sent to industry is we will not be welcoming the expansion of this model throughout the EU. So the industry needs more territory. That's what they're looking at. So they lobby. This is a massive international lobby. And Grifols is essentially the Monsanto of, what Monsanto is to, glyphosate or chemicals in that world, or agricultural world, is what Grifols and these companies are to plasma. So you're fighting with the largest pharmaceutical companies in the world, who aren't just vying for our donors and the veins of Canadians in order to, pursue this for-profit driven model, but it's an international lobby. So what's happened now since we had the Voluntary Blood Donation Act passed is that, independently throughout the world, they have been tracking the trends of the for-profit model and have essentially entrenched their position. Mm-hmm. that what states and member states and other countries need to do around the world should be through the nationalized system. And it's very important to understand that the reason we did not collect plasma in this country was not because we needed to pay people to sell it. It's because Canadian Blood Services gave nowhere for people to actually donate plasma, essentially. And so when they opened up their plasma facilities, which was during the pandemic, it's astonishing how many donors went out to these plasma centers, and they demonstrated a couple of things. Canadians will donate plasma and they'll take the extra time to do so, and they don't need to be financially remunerated, to do it. Mm-hmm. And secondly, that Canadian Blood Services can operate those plasma facilities dollar to dollar with the commercial industry, meaning they can run very efficient centers. And that's incredibly important, because one of the arguments in this issue that they use is it's too expensive for the public system to do it, right? We don't want to do it, just let industry handle it. We'll buy the drugs and we don't want to get into the collection side. But if you are running your facilities efficiently, if you're managing your supply chain and you're tracking who's using IVIG and ensuring that it's going to the patients that need it, so it's not about demand, it's about patient need. Mm-hmm. And you're being able to manage your move donors, where you need them, then you will end up being in the place that all these other countries are getting to. So Australia is almost at 60% self-sufficiency. They now run a fully nationalized plasma collection program. France is at 50% capacity. Quebec, right next door to us, is almost at 30%, which for them means the patients that need plasma will not be without it if there's some kind of crisis, another crisis. We've got Belgium, the Netherlands, New Zealand. Italy is almost entirely self-sufficient in plasma-derived drugs, and they run a complete toll fractionation model. So we have seen that when the investment comes and when there's responsible management and oversight, it's successful within a short time frame. All these countries did this within 3 to 5 years, right? This didn't take like 25 years to collect the plasma. And so that's the kind of evidence that we see and we read. And that we, have these meetings and participate with. And that's why we're so astonished that this argument keeps getting captured under this idea of just whether we should pay people or not, right? In the ethical argument, because it's actually so much more strikingly important that we have this reversed for our country, so we do not become an American model that is currently in supply chain tensions. They just made a submission to Congress in 2020 specifically saying this is the health branch of the United States government with the support of the American blood banks, stating that they have problems with this for-profit collection model because it's creating tensions with their whole blood community.
Okay, thanks, Kat. So I do have more questions, but we are going to go to the audience now so that we can engage the audience in some questions and answers. So we'll go first to maybe Karen and Pauline both had a similar, maybe a kind of similar question. Karen asks, are there template letters that I can get people to send to MPPs or another province MLAs? Do you have a fact sheet as speaking points? Not only am I an RN, but rely on weekly immunoglobulin for immunodeficiency. How do I get this volunteer act? I believe like they have in Ontario. And then Pauline Morsfield, sorry, is our beloved chair of the Canadian Health Coalition, also asks, what can the average person do, actions that we can take? I don't know if who wants to take that question.
Well, I mean, I think this is something, I mean, we're working on our new campaign right now, which we are naming Fighting for the Light, and which we believe is what we're doing in Canada to, all these products save lives for one another. So we're working on that now. And any organization that wants to adapt that, campaign is welcome to. So you can reach out to us, but we'll also be doing a launch as well and working with our friends across Canada. I think, so we'll be doing that. That's important to engage to share your concerns with Canadian Blood Services, who will send you a form letter about their discussions with, possible discussions about having private-public partnerships, and with your health minister and your local MLA. This is not just discussion, and we like I said, we represent plasma people who use plasma-derived medicines who do not want the exploitative model or a market-driven model to decide whether or when they're going to get their plasma product. They want the National Blood Services to be in control of that model, and so that's really important, is to engage on that level. This is also an issue for whole blood recipients. It's also an issue for donors. So Canadian Blood Services is a charity. They have a very clear mandate. They have the capability, and we can certainly stabilize a second tier of funding for them to double their collection model. There's absolutely no reason why that shouldn't be happening. And I think the other point that's really clear for people to understand what self-sufficiency means when we're throwing around all of these numbers, that you might not be looking at, is a basic self-sufficiency for plasma-derived products means that patients who do not have an alternative for that drug have it. That is really important to understand. So when Canadian Blood Services says, 50%, or Quebec says 30%, or, Australia will be at 60%. It was supposed to be at 60%. It just got delayed because of COVID, but they will be well on their way. And it means that those patients' lives are not going to be at risk, right? That's really important to understand. And that the additional IVIG is going to alter, other patients who might benefit from it, but they can be put on an alternative medication within that time frame. And that's really important to understand. And so this idea that, 100% self-sufficiency, and stuff, and that it kind of, I think it's often meant to confuse, people or members of the public that might not understand what that means. So we want to get to a level of self-sufficiency through our national system to make sure that patients here are not without. That's what we want to do in Canada, right? Regardless of what kind of blood, product or substance of human origin you are receiving.
I should just add, thank you, Kat. The Health Coalition has hopefully today had an op-ed in the Hill Times, I think. Am I right there, Tracy? Or we're still waiting to see. But at any rate, it's a description of the concern we have right now today with the possibility that Canadian Blood Services is going to be putting our voluntary blood and plasma collection system at risk by making contracts with the large multinationals who collect plasma, by making contracts with them that collect plasma for payment to Canadians on a large scale. And so if I'm sure we'll have that on the website either today or tomorrow. And I would encourage anybody who wants to take action to write to your members of parliament, whether it's provincial or federal, in fact, both, because it's the provincial and territorial ministers of health that actually control the Canadian Blood Services. They fund all the activities, and they are, in essence, the stewards of the blood supply. They control the board and the CBS. So we need them to realize that it's crucial right now to put limits very quickly on the Canadian Blood Services to limit what commercial contracts they can make with large international paid plasma companies. The other thing that we're asking them to do is to put in place conflict of interest guidelines that would cover the officials who are making these deals, because there's tremendous potential for private gain by selling out the public interest. We don't want that to happen. And the only way to ensure that we have a level playing field where everything is done in the public interest is to establish very clear conflict of interest guidelines.
And Danny, you had your hand up.
Yeah, it's a great question. We certainly don't have a template letter, and I wouldn't. My suggestion would be probably Budwatch would be the most qualified to put a template letter together to send to MPs and MLAs. Certainly, I would offer to get it translated into French. The second part of it, I mean, it's not real complicated, and the simpler I find when you keep it with whether they're MLAs or MPs there's two major issues here at stake, and one is the Canadian sovereignty of our blood plasma, and another issue that hasn't been talked about is the bleed on our public health system. The more of these private clinics that open, because the nurses come from somewhere, and they're coming from our already taxed healthcare system as far as human resources. Mm-hmm. But I mean, a template letter is a great idea.
Yeah.
I think that Danny made a really good point there in terms of the staffing issue, because in France, we had our meetings with the folks there who run the plasma system in March. The reason why they haven't actually expanded their model is not because of the lack of investment from the government, and it's not because of the desire to. It's been in France, they have doctors. You have to have a physician in the plasma facilities, and they can't find them. And COVID just blew all of that up, right, and exacerbated that issue for them. So they have big staffing problems for their centers. So that there is their problem. Like I said, so I'm really glad that you brought it up, because we need to be pooling the blood system in Canada is the only nationalized health system we have. It's the only one that the provinces cooperate with, together with. It's the one where we all come together as a group of Canadians and, support taking care of the members of our society by donating, human tissue. That it's so important, to the health and safety of, our fellow Canadian citizens. And that's why the question is, instead of, we could pool all of our resources together, right, provincially, federally, and as Canadians to make this happen. We know we can. Canadian, Blood Services opened their plasma facilities in the most extraordinary time the planet's ever seen with COVID, the COVID outbreak, and they still went and donated plasma. I mean, that in itself speaks such volumes to how much people care mean, the whole people we lost whole blood donors, not because they don't want to go, but because so many people are sick right now with Omicron that they can't. And so during a pandemic, when we have learned from the past that we should not denationalize this system, we should not be, solely dependent on foreign suppliers, that do a market-based, extremely unethical collection model. We need to move off of that model as much as possible. It is so important to do so, to be united not just as the community of Canadians, but for our provinces and our federal government to take that responsibility very seriously, instead of, the lobby of industry, throwing around their trinkets and their desires to make a profit off of Canadian veins. Those are all things that are not only we should do, but all the world evidence tells us to do.
Thank you, Kat. So there's been a few questions about self-sufficiency. I think I'm going to go to maybe Keith Newman's, a board member with the Canadian Health Coalition's question: what level of self-sufficiency do we need to achieve so that all patients who need plasma-derived drugs are able to get them? Should our goal be full self-sufficiency for Canada? Who wants to take that?
Yeah, I'll go ahead. I don't think there's a magic number to self-sufficiency. I think Kat's explanation was really good in that the entire usage of, let's take the example of immunoglobulins, IG, as the kind of most important or most used plasma product. Some of the use, as we said earlier, is crucial to keeping people alive. But a lot of the use is very questionable. We think about, as Kat said, about 40% of usage is for reasons that have not really been proven. So what is the level of self-sufficiency that we really need? We think it's somewhere in the sort of 50% zone. And that is to manage the patient need at times of crisis. So if we run into a shortage for whatever reason, something goes wrong with the US paid plasma system, then there's a worldwide crisis, a shortage of immunoglobulins. What are we going to do then? We're going to try to keep alive the people who would die without it. And we know that the crucial usage is somewhere in the order of 25-30%. For people with very serious immune deficiencies. There's cancer patients who need it, but we don't need it for a lot of uses that help people in their health needs, but aren't crucial. So even if we can get to these lower levels of self-sufficiency, that secures us in time of crisis. So that's not a definite answer, but it's the answer that we're looking toward in the public system. What we don't want to see is this sort of scare tactic of the plasma industry that there is such a vast need and it's growing and you'll never catch up, and really you mustn't even bother with public voluntary collection of plasma. That's a losing game. You need 100% self-sufficiency. You'll never get there. Trust us, we'll get you there. But what 100% sufficiency will get us is a plasma industry that owns the product. And at times of crisis, the price for that product and the availability of it will go through the roof. The price will go through the roof. The availability will drop. It's like any commodity. If there is a scarcity, or you can create the illusion of a scarcity, the product price goes up. We cannot afford as a nation, in either health terms or financial terms, to allow that kind of scare tactic to drive our decision making. We have to commit to voluntary collection of blood and plasma.
Yes.
Okay, thank you. So maybe I want to be respectful of the panelists' time and all of you here today. Maybe there's one more question about the number of these paid plasma centers, and then maybe we'll go to Myrna, who has her hand up, and then we'll end it there. There are also questions. I saw a few questions about whether a recording will be available. It will be. It'll be sent to all of you who attended today, so you'll get that in your email inbox, and it'll also be posted on the Canadian Health Coalition's website. Okay, so yeah, maybe if someone could answer the question around the number of these paid plasma centers, and also maybe why we don't call them clinics. Why, just something recently that I learned, why we prefer to call them centers or not clinics.
So Canadian Plasma Resources, which was the first one that we got out of Ontario and then moved to Saskatchewan, they have about 10 that they're opening, and some of them they published and some of them they don't. For example, they never put the Fredericton piece because they build quietly, so they don't want anybody to oppose them, and they don't want anybody to but the politicians know. I mean, the health ministers know. Canadian Blood Services has known this all the time, by the way. They have all of the industry's plans, and have never been vocal about fighting back after the kerfuffle with Saskatchewan, which is extremely unfortunate because it's their job to do so. The heads of blood services in the EU certainly do, and vie for and promote a voluntary system. I just want to say that this is a move off of the paid system. We all know that around the world, we have become dependent on the private for-profit market-driven system. We are moving off of this system internationally, which is why the lobby and the folks that support the lobby, who promote fundamentally the sale of all human tissue in many respects, are working so hard to stop these kinds of movements because it impedes their profits, and it puts the management of that supply in a management phase. So, and when you do that, profits go down because it becomes based on need and not the market model. So CPR has their 10. Promedics, which is the facility in Manitoba, was bought by Grifols, and Promedics plan had 14 on the deck. So right now we know that's 24 total. We think it's more because we had a meeting, I think it was in early February, with about 8 members from Health Canada. And we are working on getting all of the addresses and the locations of those facilities. But you can imagine how hard industry is pushing back, and I'm sure they're all watching now because they don't want us, to reveal where they're going to be. But you will, if you think it's not coming to your province, you are incorrect. I mean, if you're setting up in these tiny towns, you can imagine that they are going to do that in as many places where there's no Voluntary Blood Donations Act, because there's nothing stopping them from doing so. So that's right now how many, I would imagine. I mean, a pharmaceutical rep kindly told myself and a fellow ally when we were fending this issue off, and I think it was in 2016, if you do not stop them now, you will have 40 to 50 of these facilities across your country. And we will essentially be a small America, where these places are close to universities, close to food banks, and in places where, people are hit financially and use that money, and then they become hooked on the system, right? And that's what happens.
Just one, thanks, Kat, and you're absolutely right. The explosion of centers is predictable, and it just in the same vein, no pun intended. I think it's really important to address this question of why is paying Canadians for plasma any different than paying Americans? Because the argument is made that, well, we buy most of our immunoglobulins from the US system that takes plasma for payment from Americans. And it's a really important concept. Paying Americans does not threaten our voluntary blood and plasma collection systems, right? We don't lose Canadian donors to the American system, but paying Canadians for plasma does impact negatively the voluntary collection of blood and plasma. And it's especially important for blood, because blood can only be voluntarily donated. Without voluntary donation, for safety reasons, we don't have a blood supply system. So especially for blood, it's really crucial that people understand paying Canadians matters. And I thought it would be worthwhile just to read a little bit of what the Canadian Blood Services has recently put on their website. Kat is right that for years they refused to acknowledge that paying people for plasma was a danger to the sustainability of our blood and plasma voluntary systems. But now they actually acknowledge it, even at the same time behind the scenes, cooperating with the industry to bring more paid plasma centers to the country. Here's what they actually have said on their own website. A small number of commercial collection sites, this is for plasma, are not likely to have a negative effect on the national blood system supply chain. However, large-scale commercial growth without appropriate controls could encroach on the existing system for both blood and plasma collections. That's recently, yesterday, still on their website, and it's been there for about a year now. So this Canadian Blood Services itself is actually acknowledging that bringing more paid plasma centers to Canada is going to have a negative impact. And they're talking about controls, but what are those controls? And who gets to decide what those controls are? We maintain that there needs to be a public dialogue about how this invitation to the international paid plasma industry to come into Canada and make Canada part of the American paid plasma industry, how that is to be managed. And we advocate that that whole negotiation process that's going on between CBS and the big multinationals like Grifols has to be questioned. It has to be stopped, and there has to be a public dialogue about in whose interest is it for the paid plasma industry to outcompete our own national asset, our own voluntary blood and plasma supply chain.
I just had one comment to add to what Michèle has brought up, which is, for example, they used at the latest CBS meeting that Romania is now, welcoming the paid plasma industry. They're going to set up all over Romania. Well, the companies in recently the EU courts have just ruled in the favor of the Romanian government because they withheld IVIG drugs to that country when Romania was trying to introduce what's called the clawback tax, which would have helped them afford these, very expensive plasma-derived drugs. And it was horrific for, if you can imagine, for some of the, patients there and the families of some of these kids who were using this product. And so, of course, they're opposing the ruling. But they essentially, court said, and I'll put it in the chat bar, that they'd work together as a block, right? All these different plasma companies as a cartel to push their weight, right? So essentially they said, you don't get to do the laws in your country. We're not doing that. We're not paying. We're taking our drugs out of there. You do what we say. That is just not the business model you ever want controlling your supply chain. And the supply chain is from our fellows, members of our community. It's Canadian veins. And it's a human it's a substance of human origin that's finite. And secondly, the current administration in America, President Biden, has made it illegal for Mexican nationals to come over the border plasma to companies, to all of these companies that set up on the border specifically to draw them in by payment. So Mexican nationals were coming over the border of the US and selling their plasma to these big countries and then going home. And so they shut that down. And the companies are now suing Joe Biden's administration for making that law, because now, of course, they've lost all these profits because they've lost access to those donors or those people who are selling their plasma. Fundamentally, the practice should have never been allowed because there's no donor protection, because they do not live in America. They are not American citizens, and you cannot trace those donors once they go back to Mexico. So just on those premises of a safety issue, it was already problematic. But it is very telling in terms of, you know, it's not the ethics is blind here, right? It's just, they will take, you know, if you come in and you're a qualified donor, they will pay you to take their plasma. You know what I mean? Your personal story, your life circumstance, your social safety net, any of those things, it just doesn't matter, right? It's not in the dialogue of industry. So when we look and we track the behavior of industry, we can only look at the facts that are before us. And as a country, with our responsible legislative officials, we should be asking, is that what we're doing now as a country? Is that what we're doing? That the biggest charity, a national charity in Canada, that's the only charity that's nationalized to run a huge portion of our public health system that collects this public health resource, is now going to go down this line with private industry because of the unrelenting lobby, you know, and different political ideologies, that's where this argument has been captured. And I really want to put that forward, because that's what you're going to see when this starts to roll out again in the media. And what we are fighting for right now is probably one of the biggest healthcare fights that's you know, that's national, that we really need to do, because our healthcare workers in our system, they've got other things to do right now. And we shouldn't be still having this fight. We need to settle this issue, and we need to do it now.